Today on COVID-19 Local Impact, action taken on a gathering in downtown Peterborough. Trent University to provide staff and lab facilities for COVID testing.
You need a particular kind of DNA lab to do the testing, and we do have the equipment that's necessary.
And seniors adapt to new technology.
Well, the feeling of isolation is pretty awful. And I'm 83. I had an 83rd birthday last week.
Hello and welcome to COVID-19 Local Impact from the Your TV Peterborough studios. I'm Dan Malta. From Monday to today, the confirmed number of COVID-19 cases in Peterborough County remained at 28, with one of those cases confirmed as community contact. Dr. Rosanna Salvatierra has the details from today's Peterborough Public Health Unit briefing.
Thank you, Brittany, and good morning, everyone. I have some good news to begin. We are still at a total of 28 cases, so there have been no new cases since yesterday. 3 of these cases are resolved. Again, no change from yesterday. We have 4 of these cases are hospitalized, and all others remain in self-isolation. Yesterday, we tested 11 people here. This morning, when we checked, we had 6 people booked with appointments so far. We are now, for a total, we have 752 people who've been tested. And of those, 432 are confirmed negative, and 292 are still under investigation. As far as our outbreaks, we remain at 1 COVID-19 outbreak in a long-term care home at St. Joseph's at Fleming. None of the cases are in hospital, and the outbreak appears to be under control. There have been no deaths in Peterborough yet from COVID-19 that we are aware of. We have over 330 swabs in our inventory. And yesterday we learned that the provincial emergency declaration has been extended until April 13th, and it now also includes all outdoor recreational facilities. So we are working with municipal partners and others to implement the new provincial directives. Dr. Williams yesterday reiterated that people over the age of 70 years are at greater risk of COVID-19, and they should be self-isolating themselves in order to protect themselves. So what I do want to share with you today, though, is a development in that we are announcing that we have evidence to indicate that there is community transmission of COVID-19 occurring in Peterborough. And that evidence comes from one of our cases that we had been investigating, who does not appear to have a clear link to either travel or another known case. There is one other case that we are still investigating that may or may not be linked, and we're waiting for testing results on that one. So we're not sure yet whether that one will also be a locally transmitted case or not. So we have at least one case that we believe is locally transmitted, and we've always known that the positive cases are just the tip of the iceberg, and they don't reflect all of the COVID-19 activity for the area. However, this now that we have evidence that transmission is happening locally, it should serve as an even stronger reminder that everyone needs to practice social distancing and stay home. If you are a returning traveler, you must self-quarantine, and we ask that this be done in your primary residence and not at your cottage or secondary home. For people over the age of 70, we understand that there may be provincial resources to assist them, but essentially it does mean that they must seek services over the phone or internet or ask for help from friends, families, or neighbors with essential errands. So that's good advice, and it's also good advice for all of us. If we need to go out for essentials, best to limit it to one shopper. And if you are self-isolating, please get someone else to shop for you. So remember, if you are concerned about having COVID-19, you can take the online self-assessment tool. It is on our website and it's very easy to find. It's on the homepage and it's called Do I Have COVID-19? Or you can call us at 705-743-1000 to speak with the nurse. We do have nurses available 7 days a week. So with that, I will now turn it back to Brittany Cadence for further comments.
Okay, you can stay there.
I will stay here.
And
On the way to the Public Health Unit briefing today, we noticed a large group gathered outside the Sherbrooke Street LCBO in Peterborough. We asked Dr. Salvatera if any action was taken regarding the gathering.
So we did get a call and the police have been dispatched. So I would imagine they've been on the scene already. So that is a contravention of the provincial emergency orders. Right now, no more than 5 people are allowed to gather, and so the police are enforcing those provincial orders, and they did assure us that they were going to be on the scene, and maybe on your way out you can check to see whether it's been resolved.
To respond to the increasing need for COVID-19 assessment in Peterborough City and County, and to make accessing this service easier, Peterborough Regional Health Centre is now making the COVID-19 Assessment Centre available directly by phone. If you suspect you might have COVID-19, complete the COVID-19 self-assessment on the ontario.ca/coronavirus page. Based on the results of your self-assessment, contact PRHC's COVID-19 Assessment Centre directly by phone at 705-876-5086 to determine whether an appointment is required. The phone line is staffed from 8 a.m. to 8 p.m. daily. If your symptoms are severe, contact 911 and relay your symptoms and travel history to the dispatcher. In addition to Trent University's recent announcement of opening up a residence to healthcare workers, Trent President Dr. Leo Grork says in the next couple of days they will open up some labs to help alleviate the backload of COVID tests.
We're also looking into the possibility of providing labs for PHRC. You need a particular kind of DNA lab to do the testing, and we do have the equipment that's necessary. So we're investigating that possibility now. They've identified the equipment. I'm not doing the go-between, so I don't know exactly when, but I certainly would hope that in the next few days, we would be able to help them out in that regard.
Dr. Grork says summer classes at the university will be online and there will be some modifications to fall admissions for returning and grade 12 students who will be attending the university for the first time in the fall.
So we have decided that because of health and safety risks, that we will have a summer term, but it will all be online. And about 70% of the courses were online anyway. We're looking to take other courses and create online versions of them. And in some cases, students might need to take courses from other universities and get credit for them at Trent University. I would note that the provincial government has guaranteed students that they will be able to go to universities and colleges in September. We support and will respect that initiative. I think what I would emphasize is that Trent has always been very flexible in how it does admissions, and this will require some flexibility in this situation. There may be students that don't complete courses. We may have to rely on courses, maybe even in some cases, courses from last year, or we may rely on midterm grades that students have. We're looking into the possibility of perhaps having some makeup courses in particular areas if students don't have what is required to take university courses. So we have to work all those details out, but our plan at the moment is to have a regular fall semester beginning in September, and students will be able to gain admission to that semester into Trent University. I will say it has been a crazy 2 weeks to take our campuses, 2 campuses, and wind them down and put all courses online and move 2,000 students out of residence and make room for other students, that has been a very intense undertaking. But at Trent, we don't want to just work with our own community. It's very much in our minds that this is a time when we should reach out to the broader community and support what it's trying to do to manage the COVID crisis. And what we've done with PRHC is part of that, but we've done a lot of other things as well with the food bank and providing volunteer support. I mean, even simple things like babysitting that is required for healthcare workers who are working on the front line. So we're very committed to the community. And actually now, as we've gone down to reduced business, and we'll keep that going, and I think we actually have a little bit more time now when we can help the community shoulder the burdens that we're all dealing with in the wake of the COVID situation.
Our Mary Tendashat speaks with Peterborough-Kawartha MPP Dave Smith as he reacts to the Pinecrest Nursing Home COVID-19 outbreak and says the Ontario government is ensuring other long-term care residences in the province are safe.
Pinecrest is a little bit of a unique situation. We think that the virus was introduced very early on in Pinecrest. If you look at the timelines on it, it's about a 2-week incubation period. And if we take a step back, that is prior to the March break. And what we think has happened is someone came to visit that very first week of March, possibly the last week of February, and that's how the disease was introduced into Pinecrest. All of the nursing homes, all the long-term care facilities are now following the same protocol. Hopefully that will prevent that type of an outbreak continuing. With respect to Pinecrest, it's a very difficult situation. We have a large number of staff members who are testing positive for it, and we have a large number of residents. The changes that we've made to allow the nursing home or the long-term care facility to bring in staff without having to go through that full posting process is going to help at Pinecrest. My heart goes out to all of those families. It is a terrible, terrible situation there. And we want to make sure that we don't have it replicated in other places. Unfortunately, the virus got into the facility prior to Ontario seeing the spread of the disease.
Facilities such as Fairhaven here in Peterborough, a lot of residents move into that facility because they can no longer stay in their own home. They are no longer able to stay in the hospital. Are you still admitting new patients into Fairhaven at this time, or is there a complete stop of that?
Not necessarily Fairhaven, but all long-term care facilities will be, when they have openings, they will be asked to take some of the patients from the hospital. But there's a lot more protocols in place to protect. We want to make sure that we're not reintroducing or introducing the disease into the community, into any of those long-term care communities. So when someone is being released from the hospital to long-term care, they have gone through the quarantine period, and we're feeling very confident that you're not introducing the disease into that community. Every step, every measure that we can take to protect the people in those communities is being taken.
Peterborough Mayor Diane Therrien says city staff are looking at all options during this pandemic, such as using Northcrest Arena, among others, as temporary hospitals. She says the Sports and Wellness Center is currently housing between 40 and 50 of the city's homeless every night. Last night, City Council made the decision to allow residents and businesses to defer municipal taxes if necessary, but the city will be impacted by the deferred revenue.
So the impacts to the city, we're still, trying to figure out what that's going to be, and that's municipalities across the country, and as well as the provinces and the feds. Their revenue streams are not coming in how they were, so absolutely there'll be an impact on the municipal budget. But we did feel that it was important, recognizing that folks have been laid off, or businesses and entrepreneurs aren't having money coming in, that we allow people to be able to defer property tax for this month, as well as the May installments, and waive the penalties on that. So There was an additional motion last night for staff to report back on other potential measures that we might be able to offer that will help residents and businesses get through this period. But recognizing that anything that we do in that vein has an impact on the municipality. So certainly I've been, talking to mayors of other communities. So, we're all kind of grappling with this together to figure out how we're going to be able to still, finance our operations moving forward, but recognizing that we don't want to, exacerbate the problem that folks are having already paying bills. We're asking people that can still pay to pay because, there are folks that are still getting salaries. So, like I'm still paying my property taxes. Folks that were set up for, the direct deposit can contact the tax office to talk about their situation and figure that out. And I mean, it is kind of, we're learning as we go. So if people don't come in because they can't physically come into City Hall anyways to pay, but there won't be a penalty applied to that. So if there are questions, feel free to reach out to our tax office. They're, most of them are working from home, working remotely, but they're there to answer questions about what that looks like going forward. And knowing that coming up in May, again, that's going to be an even tougher time because people will have, likely been out of work for a couple of months by that point. We just set this up, and so the staff and our commissioner are trying to figure out what it's actually going to look like on the ground. But there is that 60-day sort of deferral. And so we're not, going through the list and running out trying to find everybody who hasn't paid yet. We're understanding that folks are in, a very different situation than they normally would be.
Okay.
As COVID-19 local impact continues, we'll hear from Rosemary Ganley, a local senior who's Zooming to keep in touch. Welcome back to COVID-19 Local Impact. I'm Dan Malta from the Your TV Peterborough studios. With the Ministry of Health advising people over 70 to stay home, some seniors are turning to more than just the telephone to communicate. Local activist Rosemary Ganley celebrated her 83rd birthday last week and was able to connect with her family who live in 3 different areas of Canada.
Well, the feeling of isolation is pretty awful. And I'm 83. I had an 83rd birthday last week. And I use the computer and a tablet, but I don't carry around a smartphone. I think I'm typical of my age. I am willing to learn if it's taught to me and retaught. As so there was a meeting last week and the host was from Port Hope. And I said to her, you'll have to give me a tutorial. And she did. And now then my birthday came on Wednesday, and my 3 sons, they're in the 50s, they said that they would collect the 8 grandchildren and we would have a Zoom birthday call. And they're in 3 time zones in this country. So that was another motivation.
You didn't use Skype in the past. You didn't
No.
use Zoom in the past. What
No.
was other than the meeting in Port Hope, it sounds like going forward, you may be Zooming more often.
That's right.
And can you tell me then a little bit about your decision why you went, okay, I'll try this out and see how it goes?
I'm not an early adopter of technology, but when it gets more widespread and simpler to learn, I don't have a really good aptitude for it. But I am a risk taker of all kinds. I lay my opinions out there and get reaction, and I have a good sense of humor. So when Zoom was presented as the latest but simplified for any adult, I thought I'll take that on.
So you mentioned you had a birthday last week. You mentioned that you are in your 80s.
Yeah.
Not everyone is as tech savvy as you.
Yes.
Do you have any advice for anyone that is older and is in this self-isolation?
Well, I saw a lovely story. The Premier of Nova Scotia is named Stephen McNeil, and he was touched by the photos of loved ones going to seniors' homes and shouting through the window. And he ordered that 800 tablets, computer tablets, be delivered to seniors' homes. I thought that was compassionate and insightful. Now the attendants will be busy now teaching those seniors how to, I would presume it would be Zoom, and reducing the stress and the loneliness on them. My advice is, well, have a relationship with some person, probably a younger person, who will come or at least talk to you in some way and teach. You need a patient person. I would encourage seniors as a step to reduce the isolation. I mean, we used to have telephone calls, but this is one step improved.
Northumberland County Council has done an about-face when it comes to bag tags. Earlier this month, Council voted down a motion to allow residents to place garbage curbside without a tag. But County Warden Bob Sanderson explains to Your TV's Mark Rockburn why Council has reversed their decision.
We'd previously decided as Council that we would keep everything in place, so bag tags were still required. But I think under the circumstances, we as a council reconsidered that. We would like to certainly support both financially and from a physical distancing perspective, that people don't have to go out and buy a bag tag to get rid of their garbage. For that reason, and then in addition to any relief we can give to our citizens relative to that expense, I know it's not a lot particularly, but when you accumulate it, it's for a lot of people, they've either run out of their bag tags and or it might be creating a financial burden for them. The decision of council, therefore, was to waive the bag tag fees for now. And we're not using terms like free or whatever. It is really is a county responsibility to manage garbage appropriately, and I think this alleviates and assists our citizens through a very difficult time. We still ask them to only put out one bag without a tag. The other areas are also very important. The people who are picking up garbage, they need to maintain their distances as well, and we've had some indication that some people kind of like to go to the curb when they're there and have a discussion. If you want to have that, please just wave at them. It's like all our critical emergency services. It's not a chance, unfortunately, to socialize. So we made that decision, and we're very comfortable with that. That goes through, so through to the end of May, actually May 29, because that's not technically the end of May, but I think it's a Friday, May 29.
One bag of garbage may not be enough at the curb for a family, an average family of 4 if they're at home. Can they put out more than one bag? And if so, do they have to put a tag on those other extra bags?
Technically, they should be putting a tag on, but I think we're being very benevolent. We're trying to avoid a big burden on our landfill and on the staff picking up. So certainly from a courtesy perspective, we are asking people to maintain to one bag. Also, with our recycling implementation that we've had over the last period, we've seen a significant reduction in the amount of garbage. So hopefully this will encourage people to do exactly the same, which is reduce the amount of garbage you're putting out regardless of this situation, and hopefully it'll stick through this.
CEO of the Northumberland Hills Hospital, Linda Davis, gives an update on if the hospital is currently treating any COVID-19 patients and what service changes are in place to protect the workers.
As we speak, yes, we are. We have certainly throughout the past few weeks, we've had individuals who are under investigation. Fortunately, most of those have turned out to be negative. Right now, though, we do have a positive case within the hospital.
And they're currently a patient and being treated inside the hospital?
That's correct.
And obviously all precautions are being taken for the safety of all?
Absolutely, absolutely. And we have been doing that now for a number of weeks, certainly with even individuals who might have been a suspected case. We have been using all of the precautional measures. We had the opportunity as well even to help our staff. We put them through special training on how to put on and take off the protective equipment. And we have put over 400 staff through that training now. And so people are certainly, they have the equipment, they have the training, they are able to carry out those measures for anyone to keep themselves, but also our patients safe. Staff who interface with patients are wearing a surgical mask. Those are non-COVID-19 positive. They would still be wearing a surgical mask, and that is to also protect the patient. We know patients who are with us are also vulnerable. We want to make sure we're keeping them safe. The assessment center continues to be utilized. Seeing is that people who are coming to the center are needing to be actually tested and swabbed. So the self-screening is working well. People are using that. And we have tested a fair number of individuals. I think that it's really great to know that we only have 6 positives in our county as of yesterday, according to the public health information on the website. So again, we have our rates are still low within our area, and whatever everyone is doing is working, and I can only ask them to continue to do it.
The Pinecrest Nursing Home in Bob Cajun has reported 4 new deaths at the home. As of Monday, 24 staff have tested positive for the virus, with another 10 still awaiting results. The Ontario government says it will investigate the tragic situation unfolding at Pinecrest, but won't commit to further transparency or testing at seniors' facilities. Now to send us off for the evening, Washboard Hank says goodbye. For Your TV, I'm Dan Malta. Man.
Well, I was sitting in my chair. I was all alone. I heard something ringing. It was a telephone. A voice said, "Stay where you are. You've been quarantined." I said, "Just exactly what it is that he meaned." He said, "You don't go nowhere, man. Breathe that indoor air, man. Sit there in that chair, man. You can even drink some beer, man. You don't go nowhere, because you gotta stay right there." So I went from the bedroom to the bathroom to the living room to the kitchen, from the bedroom to the bathroom to the living room to the kitchen. I didn't go nowhere.